Afternoon, everybody. Welcome to our update on COVID-19 that we are doing once a week with media questions. And we appreciate everybody joining. It's hard to believe that it's already Thursday, October 22nd. It's been more than 8 months that we've been coming and sharing COVID updates in Eau Claire, sharing with you what is current information, what is happening as a community, giving you local data and state data, and answering questions. It's been a long haul for all of us with COVID-19. We recognize that. And we're glad that you are prioritizing getting information in a way that can help you make decisions and can help you prioritize keeping our community in a better spot. A reminder that our COVID-19 eauclaire.org website continues to be a location that gets updated every day. So while we're only doing these media updates once a week, that's a place for you to get up-to-date information that is regularly, the data is regularly refreshed, and we have new information posted there as soon as we have it available. We're also really thankful, as we often talk about on this media cast, for all of the things that are happening in this community. We have businesses, schools, and individuals, many, many other partners that are making those tough choices to help slow the spread of COVID-19. They're hard because they've been going on this long. You know, the basic choices that we are all needing to make to keep our loved ones and our fellow employees and our students healthy and safe. They're easy choices in many ways, but they are also ones that are going to be around for a while and have been around for a while. We know that that's not easy, but we also know that there's a lot of shared importance in keeping the spread of COVID-19 as slow as possible in Eau Claire County. So we'll share, as usual, our state updates, our local updates with data, and then the local things that are happening, as well as state things that are happening that we think may be of importance. We'll answer some of the questions that we got in advance, and then certainly be available to the media to answer any questions that come in via chat, or you can unmute when we get to that point as well and ask questions. Again, I want to express my appreciation to Audrey, who is working from home, but supporting me at a distance. That means that we can also have this where I don't need to be masked while I'm in this media event talking to all of you, because I can be in this space by myself. So the state status update, we are now at 730,646 negative tests for COVID-19. That's an increase of more than 150,000 negative tests since last week, Thursday, when we last shared data with you. There are now 186,100 individuals that are Wisconsin residents that have tested positive for COVID-19. That is an increase of almost 24,000 since last week, Thursday. Of the individuals that have tested positive in Wisconsin, 9,855 of those individuals have ever been hospitalized. 963 new people since last week, Thursday. We also now have 1,703 Wisconsin residents that have died related to COVID-19 infection, an increase of 150 people in Wisconsin since last week, Thursday. Yesterday, 48 deaths related to COVID-19 happened in Wisconsin. It was the highest single day of death since the pandemic started. Nearly twice as many deaths in the past week compared to the week before. We are on an upward trajectory for cases, for hospitalization, and for deaths like we haven't seen in the past in Wisconsin. It's not a good sign. Once we get to the point where hospitalizations go up and deaths go up, we know we're in a place that we are not slowing the spread. We are not doing those common sense things in our community to keep from those at-risk people and the general public from getting sick. We can do this. We can stay 6 feet apart. We can wear our cloth face coverings when we're out. We can wash our hands, and we can stay home when we're sick. Those are things that every one of us can choose to do. It will make a difference in our statewide hospitalization rates. It will make a difference in our overall death rates, and it is something that we can pay attention to. Those common sense strategies that will make a difference seem to not be followed across Wisconsin. And I think we all need to lean in to convince people across the state that we need to do those things and we can do them. Over the past 2 weeks, the average number of patients hospitalized in the ICU has continued to grow. There are nearly 1,200 individuals that are currently hospitalized, and about 1 in 4 patients in Wisconsin is in the intensive care unit or the ICU. Hospitalizations have been increasing in every unit, in every part of the state, in every region of the state, including ours. Our hospitals are doing an amazing job in the Chippewa Valley. And it doesn't mean we shouldn't go to the hospital if we need to, for whatever reason, we need to seek out that type of care. But we also need to remember that in order to keep our hospitals functioning in the way that we all need them to, we're responsible for slowing the spread. We have had some local questions about the treatment that some are receiving for COVID-19, which is the remdesivir treatment. That is available in Wisconsin. It has been distributed to our hospitals across the state, including hospitals in the Eau Claire area. It is a treatment being used by our hospitals. It is not contributing to our hospitalization rate. It likely is contributing to the lower number of people dying and the lower number of ICU cases. But we do know that despite having new treatments since March for COVID-19, we are still seeing people across the state and in our own county dying from COVID-19. Treatments help, and remdesivir being available as one of those examples is a useful thing, but it also is not something that is going to make all of the deaths and all of the hospitalizations and the long-term impacts of this disease end. We also are seeing across the state that all age groups have been experiencing increases in case numbers. And we are also seeing that 18 to 24-year-old age group, where we were again across the state seeing large increases in September, they've had fewer new cases in the past few weeks across the state. So this is not being driven purely by our young adult population. This is spread in Wisconsin across all age groups. The state 7-day positivity rate by people tested, one person tested multiple times is counted as one negative and one positive if they become a positive, is at almost 23%, a very high percent for us across the state. That's been increasing since June and is certainly high for us now. The positivity rate by test, another measure that is important in looking at disease spread in our state, is at 12.3% as of yesterday. We know that these numbers are influenced by the number of tests being done. We want tests to be available and be done on anybody that needs a test. We encourage people to continue to be tested, and we are watching how spread of disease is happening across the state. In Eau Claire, the data, we have now 28,259 negative tests for COVID-19 in Eau Claire County, an increase of over 2,000 since last week, Thursday. Our positive case number is now at 2,850, an increase of 342 individuals that are Eau Claire County residents that have tested positive for COVID-19. Our average daily case numbers are now at around 50 cases a day. As you've heard me say previously, anything considered over 10 is considered a significant number of cases in a community of our size. Once we get over 25 or 30 cases, we are at that very high risk level in all national models, and we are now at 50 cases a day. The team, I would call out to our team, is working hard. They are following up on all of those cases. We have an amazing partnership with healthcare, with those that are doing testing like the National Guard, and with our team that's doing the disease investigation work and working with all of you across the community. But we have a lot of cases. We really thank not only those disease investigators, those that are doing that work out of the health department, but also those people that are answering their phones, that are taking this seriously, that are, if they are identified as a positive case of COVID-19, that they are caring enough about the community to share with us their close contacts, to stay home, and to listen to what needs to happen so that we don't have that next layer of spread in our community. We'll slow spread down if we have people taking this seriously. The positivity rate for Eau Claire County by tests is at 10%. Our 7-day average of new cases is really ticking back up to that high point that we experienced back in the beginning of September, when we really raised the level of concern because of people gathering back together, because of things like school starting. We are back at that high level again. We are straining our healthcare system because of that, and we are straining our businesses and our schools because of the number of cases and the number of people that have to be out because of isolation and quarantine requirements. Some people say that these numbers of increased cases shouldn't worry us. I will tell you that as the public health person in this community that talks to you regularly about this, I'm worried. It's only October, and typically respiratory diseases start peaking in November, December, and January. We have not gotten to those points yet. We expect to have more case numbers for a respiratory disease like COVID-19 because we will be indoors more, because we will be collecting in groups more. We need people to understand the risk and really remember that there are long-term impacts as well as short-term impacts to COVID-19. We now have, of the number of cases, positive cases of COVID-19 in Eau Claire County, 2,527 individuals have been released from isolation or have fully recovered from being someone that spreads COVID-19. That means we have 323 people in Eau Claire County who we are actively working with to remain isolated. Of the individuals that have tested COVID positive, 103 have ever been hospitalized, an increase of 20 people since last week, Thursday. So just in the last week, 20 more people that were Eau Claire County residents have been hospitalized. A reminder to everyone that we are fortunate to have an amazing regional healthcare system in Eau Claire. Many of the people that work in that regional healthcare system that happens to be in our community live in our community. Our healthcare workers are impacted by positive cases across the region being transported to Eau Claire to be in our hospitals here. We all need to work together with people across the region, multiple counties across the region that transport patients here to keep the numbers low. We now have 12 individuals in Eau Claire County that have died related to COVID-19, an increase of 3 people since we last talked to you last week, Thursday. Those people, the new 3 people, are all over the age of 65 with underlying conditions. But again, their cause of death related to COVID-19 means that except for the disease on the death certificate, it is being seen that COVID-19 was a factor that resulted in that death. The Department of Health Services at the state level now has 34 active investigations listed for Eau Claire County. That includes 12 investigations within long-term care facilities or cases in long-term care facilities, 6 workplaces, 4 educational facilities, 3 healthcare facilities, 1 group housing setting, and 8 additional other settings. The state rating for COVID-19 activity in Eau Claire County remains at that very high level, and we've been there for some time. Certainly with our case numbers edging up to the 50 cases per day, we are really exceeding that greatly at this point. As of Monday, October 19th, about 28% of our total cases since the beginning of September are connected to UW Eau Claire. We share that percent with you just because it's been something that has been of interest to people in the community, particularly in the beginning of the school year when we did have an uptake of cases. The total percent of cases connected to UW Eau Claire has been decreasing since the middle to end of September. The data through early October by age group for Eau Claire County does show that our largest rate and number of cases is in that 18 to 24-year-old age group. But again, that age group includes people that are in the working population, students at CVTC, and many, many other people. Again, these are our employees, these are our sons and daughters, our grandchildren. Again, know that high case number and high case rate in that population does mean that we all need to pay attention. The latest data that we have for Eau Claire County is also showing us that our lowest case rate is in that under 18 age group. There are likely many reasons for this and many more that we'll find out over the course of the next number of months as more research is done on this age group. But we also know in Eau Claire that there's a lot of work happening to do the basic things in schools and daycares, like wearing a face mask, keeping 6 feet distance, and doing those basic engineering practices, those things that will help us slow spread down, are happening in this community. And that's a real testimony to all of our partners across the community and the parents and families that are working with schools and daycares to make sure that spread of disease is as slow as possible. Distance, wearing face masks, minimizing the number that are gathering in a classroom does make a difference. And we know that that is slowing down the number of people that are cases, and it's slowing down the number of quarantined individuals that we have in our community. Many parts of the state, whole classrooms and whole schools are quarantining. Many parts of the state, all schools are going to virtual. And that same dynamic is not happening right now in Eau Claire, which really is connected to the fact that in-school classroom experiences are really being carefully worked on. We do know that disease spread in that age group is happening related to sporting events, both school-related and private club-related sporting events and social events. So a reminder to parents that we make choices and our choices make a difference. As much as we can talk to our young people about how important it is for them to be in school and how important it is also for them to have extracurricular activities, but doing them in a safe way is critically important as we slow spread across our community. The fewer young people that get COVID-19, the fewer close contacts there will be. So that's parents out of work because they have to stay home as close contacts with their kids. That's teachers out of the classroom because they are cases or close contacts. Our working parents and our teachers and our schools really count on all of us really working hard to do the right thing to slow spread. We also share with you weekly our jail data, our jail testing data as of Monday. 194 individuals have been tested connected to the Eau Claire County Jail. 10 of those individuals have tested positive, with 10 recovered. We do have a couple of announcements. On Saturday, this coming Saturday, from 10 a.m. to 3 p.m., we will be having a flu shot clinic, an influenza shot clinic at the Augusta Senior and Community Center. That's for children and youth age 6 months to 18 years. It's our focus to have free flu shots available to people in that age group in a setting that will be a drive-through influenza flu shot setting. The goal is that we have fewer people sick and hospitalized with influenza, which we have every year happen, so that we have space, frankly, for those that may need it for COVID-19 this winter. It'll help kids stay healthier if they get a flu shot, and it will keep them in school. It'll also help families because there'll be less likelihood that there'll be influenza within your family. If you have a regular doctor or an easy access to pharmacy or another resource to get your flu shot, please get your flu shot that way. But we will have this site available in Augusta this Saturday. Only a consent form is needed. We will serve people with and without insurance at that location. We also are using this as a test to see how we can quickly vaccinate people in a drive-up setting for when we may be doing it that way for COVID-19 vaccination. So our testing of influenza vaccination in this way will help prepare our community for potential future use with COVID vaccination. Please go to our website and look at the clinics button to get more information on this testing location. I'm sorry, this vaccination location. We are also hoping to have a second location in the city of Eau Claire down the road a little bit for influenza community vaccination as well. A reminder about voting. It's hard to believe, but our election day is less than 2 weeks away. We don't want anyone to have barriers to voting. We also know that most people don't expect to get the call when they get the call that they are a close contact to a case of COVID-19 and have to stay home and be quarantined for 14 days. We're working hard in this community to make sure people understand all of their options for early voting, for absentee voting, and for finding ways to safely vote. The clerks across Eau Claire County are doing an amazing job, just like they did in the spring and in August, to make sure that on-site voting is safe. We want people to vote, but we also want people to make a plan because, again, we don't want anybody to be surprised if on the Monday before voting, they get a phone call that they need to stay home because they are a case or because they are a close contact. So we will be providing more information as we go along about all those strategies. We encourage people to go to myvote.wisconsin.gov to get information about how to vote absentee. You have until October 29th to do that. Don't get surprised. Plan to vote, make a plan to vote, and make sure that you get that done. Every week, we also share with you our metrics. Those are those data points that we are watching at the health department and in incident command to see where we are at with COVID-19. Once a week, we really spend time looking at those and analyzing what is happening with our disease spread in this community. So I'll share a couple of those with you, but please look at the website. There is a place posted with all of those metrics that you can look at. Our case count over the last 14 days is at 572 cases, the highest number of cases in that 2-week period since the end of September. We have had 11 new outbreaks in the last 2 weeks. That indicator is in the red. Our community spread is at 43%, higher across the full month of October than we've had previously. Our positivity rate, like I shared earlier, is at 10%. It's right at the threshold between yellow and red. If it inches up any more from 10%, we will be in the red for our positivity rate. Our case contact percents and our contact tracing percents, so how quickly we can get to cases and tell them that they are positive and how quickly we can let close contacts know that they need to quarantine, is challenging. We continue to work through that, and part of the data this week is related to the update of our state system. So there was a bit of a delay over the weekend in getting to cases and close contacts, but do know that we are working through that with our staff. Also know that the state has deployed a new way to reach out to close contacts. So cases now have an ability through an online tool, which is called tellyourcontacts.org, to identify their contacts directly. As we've shared previously, we try and call close contacts that are in high-risk settings, things like schools and healthcare locations. But we are asking our cases now, because of the high volume of cases, to let their close contacts know directly. So if I am a case, I'm expected to let my close contacts, those household contacts, know that they are a close contact and needs to stay home for 14 days. If you are someone that gets an email or a text message, and it's an anonymous text message that says you are a close contact, please pay attention. If you have questions about this, though, don't ever hesitate to contact our COVID call center number. That number is 715-831-7425, and they'll help you walk through that process. So with that, I'll share a couple of the questions that we got in advance, and then we'll go to any questions that come in via chat or that people want to unmute and ask. So one question from the media in advance was that they described that there was a line at the Mayo Clinic testing site today. I wasn't aware of that, but that there was a line for that testing site. And whether or not this has been a consistent occurrence lately or any insight on the increased number of people getting tested. We do know that testing in all of our healthcare settings, as reported every Friday to us, and we likely will hear this tomorrow, testing numbers have been going up across the area in our healthcare locations. Mayo did report to us, as we asked them that question, that they are seeing a dramatic increase in the number of individuals that are symptomatic individuals and close contacts that are getting tested for COVID-19. So that is in fact accurate. Over the past few weeks, the numbers that have been hospitalized at Mayo and across the healthcare systems in our area, as I said earlier, has also increased. Again, we want people to get tested. Please contact your healthcare provider about that. Please remember that we also have testing available at our community Wisconsin National Guard associated testing sites, both in Augusta on Wednesdays and in Eau Claire on Fridays, Saturdays, and Mondays. Again, more information about all of those testing locations and opportunities to get tested are available on our website. It is important that people that need a test get a test. That helps slow the spread of COVID-19 in our community. Mayo also wanted to be sure, like all of our healthcare partners have been stating recently, that we all need to work together on those basics. We've all shared with the community that the basics like wearing face coverings, keeping distance, staying home when you're sick, and avoiding those large gatherings is critically important. We hope, all of our partners across Eau Claire really hope that people make those choices. If they notice a business that is doing all those right things, please go to those businesses. If you are noticing places that are not doing those things, pay attention, protect yourself and your family. Please really think about the choices that we make as a community. It will make a difference long term. We also got a question from Visit Eau Claire about Visit Eau Claire receiving funding, federal funding through the travel grant program to promote tourism in the city. The press release talked about from Visit Eau Claire a little bit about support marketing to support safe and healthy experience for travelers and for residents in a given COVID-19. The question asked a little bit of us, the health department, about what we thought about travel, what we thought about maybe contradictory messages related to around travel and around promoting visiting communities. I will tell you that we have an amazing partnership with Visit Eau Claire. They've been a very strong and consistent partner in getting messages out about slowing the spread of COVID-19. They're a critical partner in the Chippewa Valley Economic Recovery Task Force, and there's lots of information about that available on our covid19eauclaire.org website. We know that Visit Eau Claire, like many businesses across Eau Claire, are working hard and leaning in hard to not only following the basic best practices, but also encouraging people to get out in the community and to visit Eau Claire in new ways. So I equally have been seeing people out and about. I encourage all of you across Eau Claire to get out in our parks, to get out in our businesses, and to really show our community partners that we can, even if we're not traveling long distances, travel in Eau Claire and talk about using the glass half full metaphor, talk about how exciting it is to find new things and experience new things in this community. So I really give credit to Visit Eau Claire and leaning into the grant opportunity, but also working together to promote all those places across Eau Claire that we can and should be visiting. We also really want people to know that we're not in lockdown in this community. We can be out in the community doing things. And I think pay attention to those various businesses that are promoting those opportunities. I'm seeing those pop up all the time on social media, whether it's from Visit Eau Claire or from Volume 1 or any other of many, many different entities that are helping support that. So pay attention to opportunities and take advantage of them. So I will pause and ask Audrey if there are any questions.
Yeah, we have a question in the chat box from one of our media partners about voting. And the question is regarding, well, it says after the spring election, health officials said there wasn't a significant spike in COVID-19 cases because of in-person voting. However, we're at a place now where there's a much higher volume of cases in Wisconsin. So should people be any more worried about voting in person? And are there any tips for safely voting in person other than wearing a mask and staying 6 feet apart while waiting in line?
Yeah, I think that's a really important question. And context does make a difference. Back in March and even in August, our case numbers per day and per week were fairly low. We were not seeing the kind of case numbers in the community spread that we are seeing now. It does and should make all of us pause when we are out in settings where there are larger gatherings of people. I do encourage people to vote ahead of time if you're able to. That is a strong encouragement by all public health people across the state. If you are able to take the opportunity to get a ballot ahead of time and vote without going to those in-person settings, I strongly encourage you to do that. And I think that, again, our clerks in Eau Claire County are doing just an amazing job of making sure there's good information out there, providing resources in a whole variety of creative ways to make sure people understand how to vote and creating opportunities to do that voting. For those people that in the end vote in person, wearing a cloth face covering, keeping 6 foot distance, and making sure that you are moving as quickly as you can through that process is critically important. If you're able to find times that the polling sites are not as busy, I would encourage you to potentially look at that. And we know sometimes that's not possible. And then really make sure that you are wearing your cloth face covering and keeping distance is really the best practices that we have right now to slow the spread of COVID-19.
There were no other questions in the chat box. So if anyone is on the line from the media and would like to ask a question, feel free to unmute and ask now.
Okay, thank you very much for joining us. We really do appreciate people getting good information and updated information about what's happening in the Chippewa Valley. We also appreciate everybody that's working hard to slow the spread of COVID-19. So again, my thanks to all of you for that. We'll be back next week, Thursday, and we'll be responding to questions from the media at that point in time. Until then, please make sure you go to the COVID-19eauclaire.org website, or certainly if you have questions, don't hesitate to contact our call center at 715-831-7425. Thanks very much, everyone.